you. So, many times I sometimes envy my fellows, my postgrads, because they are learning in the era of OCD and digital fundus photography and adaptive optics and fantastic advances in technology. But then sometimes I sit back and I thank God for that I did my fellowship during the era when there was no digital fundus photography. So we used to do FFA and then send the rules for developing, and because of that we really got used to doing slit lamp biomicroscopy and visualizing the fundus, which a practice which is gradually dwindling. But believe me that this type of examination of the fundus has its own charm, its own advantages. So essentially the slit lamp, the mechanical slit lamp system of a slit lamp or the observation system is not geared to look at the fundus. You have to use an additional lens to do a slit lamp examination of the fundus. And how do you do this? There are basically two types of lenses, two different types. The non-contact lenses and the contact lenses. So these come in contact with the cornea. Now Dr. Manish has made my job easier because he showed a video of how the gonioscopy lens is placed on the cornea with a coupling viscoelastic agent. The non-contact lenses are essentially of two types, the negative and the positive lenses. The negative are the RHUBY and the -55. We'll be seeing all these briefly. Then the L/D lens and the 78 and the 90D are the positive non-contact lenses. The contact lenses again are negative and positive. The Goldmann 3 mirror is essentially the negative lens, which also uses the mirror system to look at the fundus. And the positive lenses are the PANFUNDOSCOPIC and the MAINSTER lenses, which we use mainly for our procedures. So let's look at the negative lenses. The principle here is to place a negative lens in front of the eye and create an optical system which is analogous to a Galilean telescope. These lenses, because of the telescopic system, produce an upright virtual image with somewhat limited field of view. So the RHUBY lens is a -58.6 diopter lens. It's essentially a plano-concave lens. The -60 diopter utilizes the +60 diopter refractive power of a normal eye. And that's how it gives a magnification of exactly about 1 when used with a hemetropic eye. The field of view of this RHUBY lens is approximately 30 degrees. When we look at the other one, the Goldmann 3 mirror lens, it's a 64 diopter lens. Again, it produces a magnification of about 1. The magnification doesn't change with this lens with the patient's refractive error much. That is the advantage. Now, the other plus points of the Goldmann 3 mirror lens is the measurement of objects in the fundus is possible with the Hartstein and the Goldmann lens. It provides sharpest and the most accurate view of the macula and gives excellent view of angle structures. And if you practically look at it, you have a lens which is subserving your glaucoma practice also, as well as a fundus practice. So it's a multi-utility lens. The downside is that it has a limited field of view, particularly in patients whose pupil dilates slowly or don't dilate so well. Now the Goldmann mirror lens, you have a system of 3 mirrors. Now, the smallest mirror is used for viewing the angle, which Dr. Manish so very well showed with his fantastic videos. It has an angulation of 59 degrees. Then the medium-sized mirror is used to view the retinal periphery anterior to the equator. So to look at structures like lattices, retinal breaks, or retinal dialysis. It has an angulation of 67 degrees. And the lens which has an angulation of 73 degrees is the one which is the largest mirror in the entire system and is used to view area within equatorial and post-equatorial regions of the fundus. Then we come to the non-contact positive lenses. So the most popular ones are the 90D lens and the 78D lens. The 90D lens produces a magnification of about 0.67, has a field of view of about 70 degrees. The 78D lens produces a magnification of about 0.77 diopters, but offers a somewhat no, that is not right. It offers a somewhat limited field of view as compared to the 90D lens. The 78D lens has a larger diameter than the 90D lens. The magnifications produced by these lenses are too small for them to be useful by themselves, so they are used with a slit lamp, because the slit lamp is the one which actually magnifies the view which these lenses give. The slit lamp magnifies that view by almost 10 times. So this is how the principle of these plus lenses. So it's essentially, this is a 78 diopter lens and it will give you a real inverted image like this. So you are seeing an inverted image with these lenses. The L/D lens also was a very useful tool. It was a plus 60 diopter lens that produced again an inverted real image of the patient's fundus about 17 millimeters to the observer's side of the lens. The main disadvantage that it was so close to the observer that the slit lamp couldn't be moved so back. The slit lamp really had to be moved back while using the L/D lens. Maybe that's why it lost its popularity really. Now, if you look at the contact lenses, there's a panfundoscopic lenses. These lenses are mainly a system of lenses within aperture, and it consists of a meniscus lens coupled with a spherical lens. It gives a good wide-angle view of the fundus in an emmetropic eye, extending right from the fovea to the equatorial region, and facilitates examination of pupil, even examination of the fundus even through not so great dilated pupils. These are the lenses which are preferred during laser photocoagulation. Panfundoscopic, because it gives a wide field of view, it is preferred for even pan-retinal photocoagulation up to the mid-periphery and the periphery. The MAINSTER lens is the other lens which provides somewhat reduced field of view, about 45 degrees. So it is, some of these lenses are also called as the centralis lenses. These are used again for diagnostic purposes, especially when you want to study some macular pathology, like say diabetic retinopathy or a CSR. And these are used when you are doing macular photocoagulation, in precise photocoagulation, like if you are treating a focal leaks of a CSR, or you are doing a focal or a grid laser photocoagulation. There are also the MAINSTER wide field and the MAINSTER ultra wide fields, which are used for PRP because of their larger field of view. So these are essentially all the lenses which we have in our armamentarium. I just want to make a small mention. Dr. Kashyap is going to deal with photography after my talk, but in fact there was there is now new thing about smartphone photography. In fact, there was an entire instruction course yesterday on smartphone photography. I don't know how much of you all got that, but there are now adapters which are coming with smartphones, and these adapters can be coupled to the slit lamp, and fantastic fundus pictures can be taken even with these smartphones and their adapters. So these are some of the gadgets which are going to soon come in the market and in vogue. Thank you so much for your patient hearing.